Alright, so here we have a quick mobility routine for the hips. What I'm looking at to start is just looking at the ability of my left hip here to get up into flexion and a little bit of external rotation and abduction. Feel quite tight, generally get quite tight in the groin area, especially around that adductor longus insertion, right up high in the pelvis, and just checking that kind of typical groin stretch there. We move into, just to test that, in a bit of a stretch position. This is a nice kind of position that I like to stretch adductors and the groin in, and just getting a feel for where that perception of tightness and restriction is. And generally what we see, I've got a long history of agility sort of sports with football and soccer, and the groin is a typical area, particularly for soccer players, to get quite a lot of stiffness and resulting kind of injury in that area. For me, my go-to again is just to grab a roller and search out from kind of that medial thigh area around the medial quad, the groin, and then into also a little bit of that medial hamstring, just to find out where there is any area of excessive stiffness or tightness that I can feel. And again, all we're doing here is putting in a bit of a sensory input into the system to help create a little bit of a change, and then we're going to retest and get into a bit of a stretch after. It's not long. I'll usually spend about a minute or so each side, and then follow that up with a stretch, which we'll go into in a second. Again, like I've mentioned before, what I'm looking for here is to be really safe and non-threatening in terms of the mobility work. The input should make you feel quite comfortable. Again, might be a little bit sore and tender when you're rolling over those areas, but we want it to be a really non-threatening sort of stimulus for the nervous system. We follow that up usually with a bit of a stretch into your end range. If you look at here, I sort of move between the groin and the medial hamstrings, or the medial hamstring with a little bit of a rocking motion. Again, control the breathing, make sure that you're nice and controlled, slow breathing pattern, not holding your breath, nice and easy, and just sort of move into that end range. What I'm looking for here as well is just a little bit of a retest from the first position. What you should feel is that areas of tightness, or the perception of kind of stiffness, tightness in the groin has either changed or a little bit better, or if it stayed the same, we might need a little bit more work on the roller. But a nice easy kind of roll and stretch position to try out, just to help take some pressure off those hips, improve a little bit of the hip mobility. And then what we tend to see is good hips, good hip mobility with good motor control. Takes a lot of stress off that lower back, and it works for me. So here we are, just retesting kind of that same position from the start, and just getting a sense of how that hip and the hips are dissociating from each other, which is an important part of a lot of our unilateral sports. Finish off, what I like to do is just a little bit of motor control movement work. So I'm just going into an end range or a deep squat, and obviously technique isn't perfect, but just to finish off there with a little bit of control.